Hi, my name is Rachel France, and what I'd like to talk to you about just very briefly in this short clip is spine biomechanics. So we offer a full 2-day workshop talking all about spine biomechanics. And what we should appreciate on each of our workshops is how the body is an integrated system. The spine is particularly interesting because it's a centerpiece, it sits above the pelvis, below the shoulders and the head, and it's also where a lot of people feel low back pain or stiffness from our daily lifestyles. So within our workshops we talk about several phases. There are 3 phases typically that we teach you when it comes to spine biomechanics. Phase 1 is really about preparation and capacity around the spine, and if we get the pelvis moving well first and then think about the spine and how it moves and relates to the rest of the body, this is going to set up a really great foundation. That preparation then allows us to begin a basic capacity for strength and maintenance and endurance. Once we've gone through this phase of capacity under load, through simple neuromuscular feedback positions, then we can start to challenge control with asymmetries and more complex neuromuscular challenges. Phase 2, however, we talk about Stuart McGill's work. Now, Stuart McGill, Canadian professor, is very high in the industry today, leading the world on spine biomechanics from his work in his university. And we look at his work at using his isometric core ratio tests, of which he's done several studies to demonstrate the norms or the averages across all sorts of levels and populations, understanding the flexor versus dominant strength ratios, right to left side, how to test those and then correct them. There's nowhere else in the industry we really see a focus on flexor or extensor strength in relation to core symmetry outside of this, or in my experience we haven't seen it yet. So we teach you how to understand, assess that and then correct it with specific core training. Once we've achieved a good core ratio, we then obviously want to bring the endurance strength up. And then following on from this, we go into phase 3, which is functional stability. We look at aberrant gross lumbar motion, spinal hinging, kneeling hinging. We look at cross-pelvic syndromes, the ability to control a torsal force around the spine, becoming more on a functional basis consideration. And so this phase really gets our clients, our participants, or the people we're working with on that strong foundation, ready for their sport or movement or their daily activity that they're trying to achieve. So this webinar that we're going to be looking at for the spine biomechanics is really to look at and consider those 3 phases when it comes to client exercise prescription around the core. We're going to look at some of the core myths, of which there are a few. Some are a bit old school now, but certainly they're still out there. Some people are still practicing them. So it's really important to attend webinars and CPDs to stay up to date with modern research. And if you want to know more, then this webinar is going to be perfect for you.